this brings us to our 6th podcast. I'm excited about this one because it's one of my passions, which is full arch implants.
Yeah.
And who is that man in Abbey House Dental that is the most experienced at doing this, that does the most of it? It's obviously Abdul Naseer. Welcome to the podcast.
Thank you very much. Thank you for having me.
How's your day been?
Yeah, it's been busy. Did a full arch this morning, so a bit tired, but hopefully we can do this podcast justice.
Yeah.
Yeah, so it's good. So I saw a patient in the morning, very nervous patient, really wanted sedation, but convinced her out of it, and she did amazingly well. We removed all her upper and lower teeth, and then we strategically placed implants in the upper and the lower jaw. So those are essentially screws that go into the bone, and we place these in precise positions, and then from that my technician comes in and he 3D prints a bridge that we were able to, thankfully today, screw in and give the patient a brand new smile.
And that's all in one day?
That's all in one day, and that's...
So the patient walks in with a new smile.
Yes.
In one day, all teeth removed.
All teeth removed, then we fabricate the bridge, and she walked out in tears, and that's why I love All on 4.
Yeah.
And it's a great approach. It's not the only approach, but I would say it's the best approach to give teeth that feel more natural, more like your own teeth. They're fixed. They're not like dentures which can move around. So yeah, it's a good day.
That's an amazing start. I mean, I wasn't expecting that. I was going to get into that stuff, but I mean, the fact that you did one today. Well,
yes.
It was 2, wasn't it?
It's a dual arch.
Yes.
Yes.
So that's great. Really good. And we'll go back to that case in a while. But
yeah.
I really just wanted to start off with a little bit about you.
Yeah, of course.
How did you get into the implant world? When did you start your training? Where have you done your training?
Yeah.
And what has led you to want to do mainly full arch implants?
Yes.
And why do you enjoy it so much?
Yeah.
A lot of questions there.
A lot of questions, yeah. My background is, I'm just a normal working class boy. I was lucky enough to get into dental school, graduated 2012 from Liverpool University. Then I sort of worked in general practice, and I worked in stone at a different practice, and I think that's when I got to know yourself.
Yeah.
And short story is that you recruited me, and from then, I've got to say, my career's just gone from here to here, and obviously I'm very grateful for your mentorship and direction, because I was sort of jack of all trades, but once I started surgery, I thought this is it. This is what actually, fires me up, and so I thought, let's do implant course. I did the course in Leeds with the Baird Academy.
Yeah.
In around 2016, 2017. Really good course, really good knowledge. What I like about implants is that, there's a lot of science behind it and theory, which obviously, helps me to break out from normal, boring general dentistry.
Yeah. Well, we always see Abdul's buzzing when he's doing surgery.
Exactly,
that's your
exactly.
passion,
So I've sort of if anything interests me, then I hyper focus on it. So I did the 12-month course, really enjoyed it. Then I went to Greece.
How long ago was this then again that you did your first course for implants?
I think 2017 maybe.
So coming to almost 10 years of doing implants.
Yeah.
Wow.
So then we went to Greece. I placed implants, got my hands stuck in, and then that was the foundation. I moved with yourself, and then we started with basic cases, and then you mentored me kindly to just sort of, push me, and I like a challenge, so you know, so I think this is you know, a bit of my history. Then after that, I saw that you were going to do a master's in Italy, and I thought, well, if Amit's going to do it, I need to do it too.
Yeah.
So you know, I get FOMO. So yeah, no, we did that course together. It was an amazing course. Learned, you know, advanced techniques.
I think the Italians are so far ahead, aren't they?
They're so slick.
With
Yeah.
what they do with the kind of look of the teeth and the surgeries,
Exactly.
always
Yes.
ahead of us. And I think we did that course in 4 or 5 years ago now.
Yeah.
Maybe not. I can't
Yeah.
remember. It was a long time ago. And
Yeah.
I would say the stuff that we're producing now in the last couple of years is on par now with,
It's just caught up. Yeah.
with the Italians
Yes.
and the Germans as well. You know,
Yes.
the level of aesthetic detail and stuff, some of the smart makeovers we're doing now
Yeah.
are phenomenal, aren't
Yes.
they? I just wanted to go back a little bit of when we first met. So
Oh yeah.
I think the first time we met was at one of the local dental committee meetings,
Yes.
wasn't it?
Yes.
And you were working for another practice, and we had a bit of communication there, and it was actually our Straumann rep, Amanda at the time, wasn't it, that said to me that there's a guy that's starting to do a couple of implants.
Yeah.
He'd be ideal for the practice.
Yeah.
Come and have a meeting with him, and so.
Thank you, Amanda.
And where did we go for your interview? Was it Costa?
You went Costa, yeah.
To Costa, didn't we? And we had coffee, and
Yeah.
it was a match made in heaven. Yeah, but no, it was interesting because I mean, you had that passion of doing implants and doing more of it, and we were at a point where Abbey House Dental was doing probably the most implants in the area, and we were looking for a second surgeon.
Exactly.
So that's
It's a no-brainer for me.
It made it perfect, really.
Yeah.
So you kind of have been doing implants and general implants and complex cases for a while. So what is it about? Firstly, kind of the clinical side. What do you enjoy about full arch implants? And then secondly, what is it that you like in terms of the patient response to full arch implants?
Yeah. So my favourite part of full arch clinically is it's just got to be the surgery. I love the fact that, you know, the pressure's there. We have to deliver. We have to give the best for the patient that we can possibly do. All this is, you know, it motivates me. And then putting the theory into the practical aspect of it as well. That's really important. And then learning new techniques and then implementing them and then seeing how it changes the patient's lives. That's, you know, the satisfaction level is out of the roof. And then the patients themselves, so seeing their journey from the start to finish with no teeth to having teeth again, to be able to eat an apple, you know, to smile again, to have their confidence again. And, you know, having patients, you know, I can tell you about a story, recent patient who's a builder, you know, proper macho man, big guy, you know. And, you know, just really bad teeth. And then the journey I took him through from start to finish. And then when we gave him his teeth, like, he started crying. And, you know, I first thought he's joking because I'm not good with emotion. But, you know, this is the effect that we can have. And it's a blessing. And it's also a big responsibility. And, you know, this is why it gives me that buzz.
Yeah.
Yeah.
I remember one of my first, probably second full arch that I did. The patient fitted the finals, and the patient got her dentures and put it in the bin. And I was like, that's fine, you won't ever need them again.
Yeah.
And then I asked her, I said, what are you excited about eating?
Yeah.
She said, I haven't had a steak, proper steak, and eaten an apple without cutting it into pieces for so long. I said, promise you can do that now.
Exactly.
And when I saw her at the review, she was just saying, I can eat anything. And she'd actually said to me that she's starting to put more weight on, so, because she was eating anything. And I think that's the effect of it, really. Is the fact that you're changing someone's whole perception of confidence.
Exactly.
There was another full arch patient that I saw who had a big beard.
Yeah.
And, you know, when he smiled, you couldn't really see much of his teeth. And most of his teeth were missing prior to me doing the full arches. Yeah. And when we'd finished him all off, on the review appointment, he'd shaved his whole beard off. And he's like he said, he's had a beard for like 20 years.
Yeah, it's the confidence,
so
isn't it?
He's confident to show his face again and show his teeth.
Yeah.
And I think sometimes we forget, because we're so used to doing so many implants,
Exactly.
we forget the effect that it has on patients.
Oh yeah.
Now talking about that, like I've been doing full arches now for over 10 years, and the way I used to do full arches when I first started is very different to how Abbey House Dental is doing it now. Very, very different.
Yeah.
When the first cases, we were placing the implants.
Yes.
We would wait 3-4 months for the implants to take. Then we would be doing impressions, molds of your mouth, and sending that to the lab and getting a couple of designs of teeth made back and forth. And the whole process of making the teeth usually took us, from the first mold that we took, about 8 weeks, because we were going back and forth with the designs and the bite and everything. How is it different now? What is it that you're doing this on a kind of daily, weekly basis now? What is that workflow? What does it look like? I mean, what technology are we using?
Exactly. So, I mean, the way that you used to do it as well, it's still a good option, and it's still suitable for certain clinical situations. But moving with the times, especially like you mentioned, Italy, things are becoming more digital. So we're able to use new advanced techniques such as photogrammetry, IO Connect, scan bodies. We can 3D print bridges on the same day using our technicians or even our own 3D printers, and we can design it ourselves. So it's very fast paced, but we're now able to, as I did today, is place the implants where we want them. As long as we get good stability, we can load on the same day. So today's case was we used IO Connect. So our technician came in, we gave him the scans, and then he designed and printed the bridge. A couple hours later, we screwed the bridge in, and the patient left with teeth. So that's all in one day, and that's a big change, and this is what patients are expecting from us more and more, and I'm more than happy to deliver that for patients.
Yeah, and I remember when we used to plan these cases, from the day we did the consultation, we would refer out, and at the time we used to refer to Stoke Hospital to do our CT scans. So the patient would go to Stoke Hospital, get a CT scan done. That might take a month.
Exactly.
Get the scan back. Then I'll do the molds of the mouth and prepare what the patient is going to walk out with the denture, so get all of that work done and get the design of the dentures done. So by the time we were ready to place the implants, we were talking 8 weeks, 8 to 9 weeks of just getting to that point, and the patient on the day would walk out with a denture that they'd have to kind of remove. Now, with the workflow at the practice, is that you effectively, on the day of your consult, we do a digital scan. We do a CT scan on site, and we have a CT scanner in Stafford practice and in the Stoke practice.
And the Rugeley.
And the Rugeley practice, and that all gets sent to our technician, who can plan it pretty much within a couple of days. So there's been cases where we've done a consultation and we've been making the teeth and taking the teeth out and making the fixed teeth within a week.
It's amazing.
And that, if you think about it, in just a span of 10 years, we've shrunk that treatment down by months.
Exactly. It's just a better patient experience.
It's much better patient experience. It's just much nicer not having to do those molds in the mouth,
And then the dentures, sometimes they keep rocking on the implants as they're healing, and then it's just not ideal.
So talking about the different options then, so we've spoken a lot about we haven't spoken about that, but full arch implants is sometimes called all on 4, which is what a lot of people hear. Teeth in a day, all on 6, all on X. These are all different terms of the smile in a day. These are all terms that, and I think the trend is to have that as your primary treatment. Now, me and you prefer to do that treatment, don't we? Because it gives the patient the best outcome. Gives them a fixed option where they can chew and eat. But there are alternatives.
Yes, there are alternatives, of course.
And what are they?
So you've got a traditional denture, which uses suction to stay in the mouth. And a well-made denture, is absolutely fine. However, I find that a lot of my patients struggle with dentures. Some of them, they just tend to move around. They don't have that great suction, or some of the patients find that the dentures make them gag. So another option, which is quite a cost-effective option, is where we can place on the upper jaw 4 implants and on the lower jaw 2 implants, and then what they can essentially have is a denture that clicks onto these implants, and that gives them a denture that doesn't move around. And it's an easy fix, but again, patient outcomes, they absolutely love it. And again, with these, they can eat an apple as well. So, there are options. I will still say the All on X option is the more premium option, because it replicates your teeth because it's fixed. But yeah, there are other options as you've mentioned.
Yeah, so the denture locator, and then sometimes on certain patients who do a bar, don't we?
We can do a bar as well. So instead of these press studs, you will have a metal bar that connects the implants.
Yeah.
And then the dentures will sit on top of that. And that's a great option as well. Fantastic option.
Having said that, over the kind of 4 or 5 years, we're doing less and less locators and less bars because patients want something more fixed.
Exactly.
When you're looking at these cases, Abdul, what is it that you're looking for? Which patients can have all on 4? Can everybody have all on 4? What is determining you to say yes, you can have all on 4?
Majority of patients, if they improve their oral hygiene, reduce smoking, majority of patients are suitable for this. But it doesn't mean that we're going to remove everyone's teeth just for the sake of it. So there has to be clinical reasons, and that's usually because teeth are too badly broken down, and they can't be saved, or the teeth are very loose over years of gum disease. So yes, majority of patients can have it, but there are certain indicators that one option may be better for them. A denture might be a better option, especially if certain conditions such as bisphosphonates. Some patients take medications that affect the bone, so it might not be the best option. However, I would say 99% of patients are suitable for this option. As long as they are willing to put the work in, we are willing to meet them as well and give them the option.
Yeah, we do have a lot of patients for consultations that say that they've lost all their bone due to gum disease.
Yes.
And so they've been told by their previous dentist at other practices that they can't have implants or they
Yes.
can't have it. What is your answer to that?
Well, we're always happy to give the patient a second chance. So just because you've lost bone doesn't necessarily mean you can't have implants. There are ways around it. Recently, as you know, Amit, I went to Brazil. I've learned how to place implants into the cheekbone. So we can even use different sites for the anchorage of the implants. So I would say that there is always a way, and we can do bone grafting. So I wouldn't say that's necessarily a reason not to have implants.
So in your experience, have you ever had a case where patients come in, you've done your CT scan, and you've realised they can't have all on 4? Because I personally haven't had a case like that. There's always been a route to giving patients implants.
Yeah, I mean, the more and more as we've learnt through and the technology improves, there hasn't been a patient where I've said no, that generally wants the treatment and requires the treatment. We can find a way for it to work.
I'm fascinated with the course that you recently did. So
yes,
the majority of the implants we place is in the top jaw. We place it where there's bone at the front, isn't there? And sometimes there is no bone at the front.
Exactly.
And so the course that you did was teaching you how to place implants in the cheekbone. There's zygomatic implants.
Exactly. Yeah.
And the pterygoid implants. So these are terms that people say. Was that interesting going to Brazil and seeing that? Because they do a lot more often, don't they?
It was amazing, yeah. So this is something that, I haven't seen in the UK before. So me experiencing this for the first time. I mean, there are courses in the UK, but this particular course that I picked, it was just lots of hands-on experience, getting stuck in, and from doing no zygomatics, within a week I'd done 7 zygomatic implants and numerous pterygoid implants. It was just it's just, this is why I enjoy what I do, because there's always progression in implants, and there's always something new, something changing. The literature is always being updated. For example, in the past there was short implants, people would avoid them, but now studies are showing that short implants are a good feasible option. So yeah, the course was exactly what I needed at the time. Yeah.
And there's very few clinicians that can do pterygoid and zygomatic implants in the UK. A handful, really.
Yes.
And I don't know anyone in Staffordshire that can offer that treatment. So I'm so glad that you went on that course.
I'm great.
Patients in Staffordshire can have treatments that in other circumstances wouldn't be able to even contemplate having this treatment.
No, I'm grateful. Like I said, I'm grateful for your help in pushing me, because if I hadn't got the push, I would have been still in NHS dentistry, and that's absolutely fine. But I think having that push, having that mentor, someone to fire you up, it can change your life, and thank you.
Thank you.
Yeah.
So talking a little bit about where you see full arch implants going in the next 5 years. So right now we've got a really slick process, it's fast, it's efficient, we're getting good results.
Yes.
Is all the technology out now, or is there more to come in 5 years? Where do you see full arch well going?
The technology is rapidly, it's just going only one way, and that's upwards, and with AI as well come in, and it's just going to keep changing, and we're just going to have to keep on top of it, doing continued education, and just deliver the best we can for our patients, because this is what Abbey House is about. It's about excellence and being the best you can. Yeah.
I can't imagine there's anything new coming, but we say that every year.
We say that every year.
There's a new scanner, there's a new this, there's a new that, and so I think there's going to be a lot more AI.
Yes.
100%.
Yes.
I think a lot of the designs and stuff for the teeth. I think the material we're using at the moment for all our full arches, zirconia, is one of the strongest materials in the world, and so we're getting less and less problems. When I was doing full arches a long, long time ago, it was a combination of metalwork and porcelain.
Yeah.
And we did have issues with that, but with the zirconia now, it's at the
very
forefront.
Strong material,
and it looks amazing.
It looks so good.
Sometimes you can't tell, can you? If it's a real tooth or an implant, it's pretty much easy to kind of find out.
Yeah.
So we're coming to the end of it. Where do you see your career going in 5 years? Hopefully you're still here with us.
Yes.
I hope.
No. I was going to say I was going to buy your practice, but no. Just keep on doing what I'm doing. For me, it's what I love most about dentistry is the connections I form with my patients. So if I can deliver the best for them and they're happy, that makes me happy. So I'm going to carry on doing that. Currently, I've also been starting to mentor with a dentist a little bit. So I think that's a route that possibly I might be exploring. But if not, we'll just buy your practice.
Normally at the end of the podcast, I would present you a book.
Okay.
So I'm pretending to present you a book.
Oh, okay.
Because I already gave you a book, didn't I, last week?
Yes.
And, the book I chose for you was 4,000 Weeks.
Yes. Perfect timing, perfect book for me.
4,000 Weeks, isn't it? And why I chose that book for you was that you've always been very driven and very goal focused.
Yes.
And the next thing and the next thing and the next thing, which is amazing. And that's why you're a super achiever. But why I like that book for you was sometimes I feel we've got to slow down.
We've got to enjoy life as well.
Enjoy life and enjoy what we're doing. And I think, I hope it was a good choice because I know you started to read it. What were your thoughts?
It's an amazing book, perfect timing. I've made a few changes personally as well. You're completely right. We've got to work hard, but we've got to play hard as well because life is only how many weeks?
Yes, exactly. And that's the end. So thank you so much.
Thank you very much.
It's a brilliant podcast.
Thank you.